Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Welcome back, everyone, and thank you for listening to Depictions Media. We're going to start off with the global figures for coronavirus, and they look like this. 464,683 total cases, 20,942 deaths, with 113,802 recovered, leaving us with a recovery percentage of 84%. And here in Canada, we are at 1,959 cases, with British Columbia having 617, Alberta 358, 72 for Saskatchewan, Manitoba 11, Ontario 588, Quebec 221, 18 New Brunswick, 51 Nova Scotia, 3 for PEI, Newfoundland Labrador 4, Yukon 2, Northwest Territories is 1.
Thank you, Margaret. Good morning, good afternoon, and good evening wherever you are. The pandemic continues to take a massive toll, not just on health, but on so many parts of life. Yesterday, the government of Japan and the International Olympic Committee took a difficult but wise decision to postpone this year's Olympic and Paralympic Games. I thank Prime Minister Abe and the members of the IOC for making the sacrifice to protect the health of athletes, spectators, and officials. We look forward to next year's Olympics and Paralympics, which we hope will be an even bigger and better celebration of our shared humanity, and look forward to join. We have overcome many pandemics and crises before. We will overcome this one too. The question is how large a price we will pay. Already, we have lost more than 16,000 lives. We know we will lose more. How many more will be determined by the decisions we make and the actions we take now. To slow the spread of COVID-19, many countries have contributed or introduced unprecedented measures at significant social and economic cost, closing schools and businesses, cancelling sporting events, and asking people to stay home and stay safe. We understand that these countries are now trying to assess when and how they will be able to ease these measures. The answer depends on what countries do while these population-wide measures are in place. Asking people to stay at home and shutting down population movement is buying time and reducing the pressure on health systems. But on their own, these measures will not extinguish epidemics. The point of these actions is to enable the more precise and targeted measures that are needed to stop transmission and save lives. We call on all countries who have introduced so-called lockdown measures to use use this time to attack the virus. You have created a second window of opportunity. The question is, how will you use it? There are 6 key actions that we recommend. First, expand, train, and deploy your healthcare and public health workforce. And second, implement a system to find every suspected case at community level. Third, ramp up production capacity and availability of testing. Fourth, identify, adapt, and equip facilities you will use to treat and isolate patients. Fifth, develop a clear plan and process to quarantine contacts. And finally, number 6, refocus the whole of government on suppressing and controlling COVID-19. These measures are the best way to suppress and stop transmission so that when restrictions are lifted, the virus doesn't resurge. The last thing any country needs is to open schools and businesses only to be forced to close them again because of a resurgence. Aggressive measures to find, isolate, test, treat, and trace are not only the best and fastest way out of extreme social and economic restrictions, they are also the best way to prevent them. More than 150 countries and territories still have fewer than 100 cases. By taking the same aggressive actions now, these countries have the chance to prevent community transmission and avoid some of the more severe social and economic costs seen in other countries. This is especially relevant for many vulnerable countries whose health systems may collapse under the weight of the numbers of patients we have seen in some countries with community transmission. Today, I joined United Nations Secretary General Antonio Guterres, Under Secretary General for UN OCHA Mark Lowcock, and UNICEF Executive Director Henrietta Fore to launch the Global Humanitarian Appeal to support the most fragile countries who have already suffered years of acute humanitarian crisis. This is much more than a health crisis, and we are committed to working as one UN to protect the world's most vulnerable people from the virus and its consequences. We also welcome the Secretary General's call for a global ceasefire. We are all facing a common threat, and the only way to defeat it is by coming together as one humanity, because we are one human race. We are grateful to the more than 200,000 individuals and organizations who have contributed to the COVID-19 Solidarity Response Fund. Since we launched it less than 2 weeks ago, the fund has raised more than $95 million. I would like to offer my deep thanks to GSK for its generous contributions of $10 million today. Although we are especially concerned about vulnerable countries, all countries have vulnerable populations, including older people. Older people carry the collective wisdom of our societies. They are valued and valuable members of our families and communities, but they are at higher risk of the more serious complications of COVID-19. We are listening to older people and those who work with and for them to identify how best we can support them. We need to work together to protect older people from the virus and to ensure their needs are being met for food, fuel, prescription medication, and human interaction. Physical distance doesn't mean social distance. We all need to check in regularly on older parents, neighbors, friends or relatives who live alone or in care homes in whatever way is possible, so they know how much they are loved and valued. All of these things are important at any time, but they're even more important during a crisis. Finally, the COVID-19 pandemic has highlighted the need for compelling and creative communications about public health. Last year, WHO announced our first Health for All Film Festival. The volume, quality, and diversity of interests far surpassed our expectations. We received more than 1,300 entries from 110 countries. And today, we're announcing a short list of 45 excellent short films about vital health topics. We're also announcing a distinguished panel of jurors who will judge the shortlist, with the winners to be announced in May. We will be showing all the shortlisted films in the coming weeks on our website and social media channels. In these difficult times, film and other media are a powerful way not only of communicating important health messages, but of administering one of the most powerful medicines, hope. I thank you.
All right, next up is Dr. Bonnie Henry, BC health official during this COVID-19 outbreak in British Columbia, and she's going to update us on some things that have happened around British Columbia, more particular in Victoria and near Vancouver, and she's going to touch on some. She was asked some questions during the press conference about construction sites being open and things like that, where she says that maybe the construction sites are actually a low risk thing, but they need to be monitored very closely by Safe BC and some other comments that she has, of course, about social distancing, staying apart from each other, things like that. Okay, so here we go.
Detected with COVID-19, and that is the Broadway Pentecostal Lodge in Vancouver. In terms of the long-term care homes, we have no additional cases today at the Lynn Valley Care Centre, though unfortunately we do have one additional death from that outbreak. Hollyburn and Delta View, the German-Canadian House, Dufferin Care Centre, Little Mountain Long-Term Care, and Evergreen Heights, which we've reported on, have had no change in the number of residents or staff affected at this point, but there has been an increase at Harrow Park, where we now have 28 residents and 27 staff who have been affected by COVID-19. Currently, there are 64 people hospitalized in British Columbia, and of those, 26 are in intensive care unit today. On the positive side, we now have 183 people who have fully recovered from COVID-19 in BC. As mentioned yesterday, the coroner's office is investigating the death of a dentist to determine if this death was related to COVID-19, and I want to express again my condolences and my thoughts to his family, who I know have been extremely affected by this, and it has been a very challenging few days for them. I want to say that the coroner's investigation is ongoing, and I do not have any further details to report at this point. So we have As we know, yesterday I was also asked for information on healthcare workers specifically, and whether we had a breakdown of healthcare workers who have been affected by this. And looking right now, I do not have the exact numbers of healthcare workers unless they're related to the clusters, particularly the clusters in long-term care or in hospital that we've had. So we have those 9 long-term care facility outbreaks, and we've had the 1 hospital. And of those, we have 55 healthcare workers who are affected from those outbreaks. For most of the other healthcare workers who have been involved in these, who have tested positive, their exposures have been more in the community, and so they have not been identified. For example, the number of dentists that we've had are also healthcare workers, but their exposures have not been in the workplace. But we do, it does draw attention again to the fragility of our long-term care facilities and the risk that we put the residents of long-term care, and that is why we have put on some very strong measures, not only for the facilities where there have been outbreaks, but doing everything we can to try and protect our elders and seniors in those long-term care homes around the province. And I talked yesterday about the order that we're developing that will help ensure that healthcare workers are able to work at one facility only, particularly during this critical time, to best protect our elders and seniors in these facilities. As well, there are additional measures in the outbreak facilities around personal protective equipment, restriction of visitors, and restriction of visitors in all of our long-term care homes across the province. And I know this is incredibly challenging, particularly when it's our loved one who is in one of these facilities. And I know staff are going out of their way to try to find ways to keep you connected with your loved ones, and we will continue to do that. We have been, as you know, we've talked about this many times, actively monitoring our supplies of personal protective equipment, recognizing that the protection of our healthcare workers and our healthcare systems is of paramount importance in this outbreak. In the past week, we have seen a dramatic increase in use as we've had more people with COVID-19 in hospital, and we understand the absolute need to keep people safe. But the burn rate, as we call it, is much higher than we would have expected, and we are putting in place measures now to try and control that and be more efficient and effective in how we're using PPE. We have new shipments on order. We're looking at things like alternative supplies across the board, alternative ways of preserving personal protective equipment so it is available both now and in the future. And we're at a bit of a critical phase with personal protective equipment. This happened quite quickly. We have had a number of supplies on order for some time. Some have arrived, thankfully, and we are actively looking at how we can get as much as we can in the short term. But we are looking at alternative supplies and ways of managing to be more efficient in PPE, and more of that will come out over the next coming days. Finally, I did want to talk about public gatherings, which is something that we've talked about a little bit over the last couple of weeks. And as people are aware, I have given an order prohibiting gatherings larger than 50 people. And we talk about 50 people, and initially there's no science behind that. It's around what's been done in other places with sort of a manageable, reasonable number of people where you can maintain distance with that number of people. But this is not an order of convenience. This is something that is required to protect people, and we know that 50 is not an absolute number. It is the maximum, but we know smaller is better. And we really, at this point in time, particularly the next 2 weeks, as we're trying to delay the onset, prevent the transmission of this virus, we need to continue to not meet in groups, even groups of 10, even groups of 20, small groups, even 2 or 3 can sometimes be that transmission point. So we're not talking about workplaces and areas where people live, where you can put in place measures to try and increase separation. But we're talking about gatherings, about having people over to your home, about gathering together in the park. These are things that right now we can't be doing. We need to connect virtually. We need to have a safe space between us for the next little while. And that includes That includes celebrations and ceremonies. I recognize when we're in a crisis, when communities are in crises, having celebrations, having ceremonies is a way of helping to cope, helping to understand what's going on with these critical times. But there are also times when we may expose those who are most vulnerable in our community, our elders, our seniors, people who are more at risk because of their underlying medical conditions. And I'm asking you right now, the leaders in our community, our faith leaders, our spiritual leaders, our community leaders, that we need to come together virtually to protect those in our communities over the coming weeks. And that means that we need to find alternate ways of coming together and sharing the information, the support, the connectivity that we have as a community without being physically together. So again, it's talking about physical distance and social connection. It is very important right now that we come together in our communities and support each other, but we do that in a virtual way, and we have a safe space between us to stop the transmission of this virus. So I've said it many, many times. There are things that we do to support ourselves in this community, and we have to be kind, we have to be calm, and we have to continue to be safe. Thank you. I'm happy to take questions.
Okay, we will move to the question segment now. As a reminder to everybody on the phone, please limit your questions to one question. You press star 1 to enter the queue, and please unmute your phone. You will not be audible until you are patched through, so take your phone off mute. Our first question comes from Mike Howell with the Vancouver Courier. Go ahead, Mike.
Good afternoon, Dr. Henry. I'm wondering, how did the infection rate at the Harold Park Center in Vancouver increase from 1 case reported March 18th to 55, I believe, today? And are any of those cases connected to other long-term care facilities?
Yeah, so the initial cases at Harold Park were a resident and staff, and then it became apparent over the next few days that others had been exposed to those people. So it is not surprising to us that we're seeing an increased number of people being affected by this. None of the people are in hospital. All of the residents and staff are either at home or continuing to be at Harold Park. But as we saw, once you've been exposed, we have no way of protecting you from getting sick. So over the period of the incubation period, we've started to see more staff and more residents become ill. What's really important is the outbreak measures that are being taken in Harold Park to prevent all of those people who had been exposed before and were now developing illness, making sure that they are isolated as they develop their illness so they're not passing it on to others. And that's been the focus of the outbreak. Unfortunately, we know that this has quite a long incubation period, so those who had been exposed before the first cases were recognized are the ones that are now developing illness.
Okay, next question, Ethan Sawyer, CBC.
Hi, Dr. Henry. My question pertains to testing. CBC.
In other areas with British Columbia, there has been an announcement that there is going to be some relief for renters and landlords to help ease the thought of, hey, I'm not getting any rent from my tenants, and the idea, hey, I can't pay my rent. There is going to be a way that you will be able to apply through BC Housing to get funds that will be paid straight to your landlord because, hey, your hours are being cut back too far or you've been laid off. So you can help pay your rent. And if you're a landlord, it's not like you're worried, oh, are they going to pay it because they received the funding from the province, and are they going to actually give it to me? The thought is that they will actually pay, the province is going to pay the rent straight to the landlord to cover the rent. In another broadcast that we did a press conference with John Horgan and the team around that. You can find that on the Depictions Media broadcast, or find more details.
In 60 minutes.
So, next up, to unveil some details about what's going on with the federal government and across Canada, we have Justin Trudeau, who's going to unveil some pretty cool things that will help workers here in Canada get funds to be able to pay bills and help keep things moving. I will take a quick note on this, that because we're going to leave the broadcast after I play this, that there wasn't a lot of mention around how this is going to help small business. There's going to be more. I understand there's going to be more details on how the federal government is going to actually help small business ride this through, weather the storm, as you will. And so we'll keep going with those updates as they come. All right. Thanks for listening.
Good morning, everyone.
Right now, a lot of people are sitting around the kitchen table with bills, trying to figure out what needs to be paid and how to plan for the coming months. If you've been laid off, had your hours reduced, or are worried about your industry, these might be really stressful decisions. Far too many Canadians are having these tough conversations about finances and their future. Just look at the numbers. Last week, almost 1 million people applied for employment insurance. The hard truth is that people are out of work because of this crisis and worried about what comes next. So I want you to know that we'll be there to help you. Our government is doing everything we can to be there for you.
Early this morning, the House of Commons passed an emergency bill to help people as quickly as possible. The bill is now before the Senate. I do hope that its passage will be done quickly so that we can help Canadians as soon as possible. We will have more details about this later this week and further measures to announce. And this is only the beginning. But this new legislation will allow us to take the necessary measures to support you immediately. We will be enhancing the Canada Child Benefit and delaying by 3 months the time to repay student loans. And with this legislation, we are introducing the new Canada Emergency Response Benefit. This benefit will replace the two benefits we announced last week, the Emergency Care Benefit and the Emergency Support Benefit, in order to simplify the process. As I've been saying from the outset, as the situation evolves, we are adjusting our efforts to help you better. The Canada Emergency Response Benefit will provide $2,000 a month for the next 4 months to workers who are not getting a paycheck because of COVID-19. So if you've lost your job, or you were working on a contract basis or were self-employed, this benefit will be there for you. If you're sick or in quarantine, or if you're looking after someone who is infected, this benefit will be there for you. If you have to remain at home without receiving a salary to look after your children, or seniors, this benefit will be there for you. And even if you still have a job, but you're not receiving any salary because of the crisis, the new Canada Emergency Response Benefit will be there for you. There will be an online portal to put through applications. It will be available very soon, and people will start to receive money within 10 days of applying.
Emergency Response Benefit will provide $2,000 a month for the next 4 months for workers who lose their income as a result of COVID-19. This will replace the two benefits we announced last week, the Emergency Care Benefit and the Emergency Support Benefit, in order to streamline the process. Like I said from the start, we will adapt our approach wherever needed. If you've lost your job because of COVID-19, whether you're full-time, contract, or self-employed, this new benefit will be there for you. If you're sick or quarantined, looking after someone sick, or at home taking care of your kids, it's there for you. And even if you're still employed but not receiving income because of this crisis, the CERB is there for you. An application portal will launch as quickly as possible, and people should start receiving money within 10 days of applying. I know people are concerned about delays. Families are worried about when they'll get help. It can be hard to get through on the line, and that is frustrating. Public servants are working around the clock while dealing with unprecedented demand and all of the same personal stress everyone else is facing. They will get to your application. Help is on the way. In order to speed things up, we're rapidly deploying workers from different departments to deal with claims. In the last 10 days, we've boosted the team by close to 13,000 people to take your calls, process your claims, and get you the support you need. And since last Monday, we've already processed 143,000 employment insurance claims. That means more money will go directly to people right across the country. We're working to get you the support you need when you need it. And if you're doing okay, there's a way you can help someone else, as an employer, a landlord, or even just a friend, so you can be part of the solution. It can make all the difference, because it's by working together that we'll get through this. And our team knows that. We're collaborating with the provinces and territories, as well as with First Nations, Inuit, and Métis Nation communities to coordinate our efforts and ensure that everyone is supported. Earlier this week, with the premiers, we also discussed testing for COVID-19. We know that how long you wait for your results varies widely. The premiers and I know we need to address that, and we are. This is something Minister Hajdu and I discuss with officials every day, and we'll continue doing what's needed to speed up results for everyone. But I also want to recognize the incredible work medical professionals are doing on this front. According to Dr. Tam, we're now testing about 10,000 people a day. That's a huge increase in numbers in a very short period of time. And it's because people across the country are working tirelessly to make it happen. At the same time, we're helping companies, labs, and scientific institutions produce and supply what we need most, from masks and ventilators to vaccines and antiviral drugs. We're collaborating with airlines to get Canadians home from abroad and instructing everyone that they must isolate at home for 14 days. We're also working with our international partners on this crisis. This morning, I had calls with President Sall of Senegal and President Kagame of Rwanda to share strategies on keeping people safe and addressing the economic impacts of this pandemic. I've also spoken to Prime Minister Abiy of Ethiopia and President Kenyatta of Kenya about international coordination. And tomorrow, I'll be speaking with other G20 leaders to discuss further global coordination to our response. Plus que jamais,
more than ever, it is absolutely essential that Canadians have access to the most recent information. But like everyone, the media are also feeling the consequences of this virus. To ensure that journalists can continue to do their work, it is even more critical in the midst of a crisis, and therefore our government is announcing measures to support them. Minister Guilbeault will provide additional details later, but in the meantime, I want to thank all journalists and our Canadian media who are keeping Canadians aware of the latest developments with facts and reliable information. We very much appreciate your work.
Right now, it's more important than ever that Canadians have access to the latest news and information. To ensure that journalists can continue to do this vital work, our government is announcing new measures to support them. Minister Guilbeault will have more to say about this shortly, but I want to take a moment to thank our journalists and media for everything they do, today and every day. Above all, the most important way we can work together is by staying apart. Social distancing is our best tool to stop people from getting sick. I know people are seeing different graphs about how effective social distancing can be and new maps tracking the spread of this virus. Every time you turn on the TV or go online, you probably read something new. I know I do. And you'll want to know what's coming next. Today, I'll be getting the latest modeling from the Public Health Agency of Canada, and we'll discuss how to share this information even more directly with all of you. But you deserve the best information we've got about what's happening today and what tomorrow might bring, because otherwise, the uncertainty can be really tough, not just for your routine, but for your mental health, too. We're facing a once-in-a-generation challenge, and on top of that, you can't do many of the things that keep you feeling good, getting together with friends or having dinner with your neighbor. If you need help, reach out to your neighbor, to a sibling, to a friend, to a hotline. But do it from home. Don't go out unless you absolutely have to. If you're already following these rules, thank you for doing your part. If you aren't, know that you're making a dangerous choice. Because ignoring these rules puts every single one of us, yourself included, at risk. Voici la réalité.
This is the reality. If people refuse to follow the recommendations, our doctors and nurses have a more likelihood of contracting COVID-19. And if our healthcare professionals get sick, they cannot go to work. And therefore, they cannot take care of you if you get sick. Our country is facing the greatest healthcare crisis in its history. We cannot allow ourselves to put people at risk who take care of our health. So instead of inviting people over for dinner, don't do it. That puts everyone at risk. Grocers, technicians, bus drivers, farmers, people who collect our garbage, all of those people deserve better. We must protect them. It's not hard to do what we're asking you to do. Just stay home. If you absolutely must go out, keep a 2-meter distance between you and others. And if you are coming back from travel abroad, go directly home and stay there for at least 14 days. That applies to everyone. In order to come through this, we must all look after each other, and we must all do our share. I know that we can do this, and I know that Canadians are equal to the task. Thank you.
Okay, we do actually have the clip with John Horgan and the Minister of Housing, Senator Robinson, giving us an update on how the renter program is going to work. Let me play that clip for you right now, and we will talk to you tomorrow. Thank you.
Thank you everyone for joining us here, of course mostly online or virtually. I would like to acknowledge and thank the Songhees and the Esquimalt nations, the Lekwungen-speaking peoples, for having us here on their traditional territories. I'm Spencer Chandra Herbert, the MLA for Vancouver West End, Premier's Advisor on Rental Housing. I want to thank everybody. Obviously, it's been a long couple of weeks, a challenging couple of weeks. The patience, the compassion, the care you're showing for your community, for each other, for everyone is really noted and appreciated. It's a challenging time, no question. And one of the challenges people have been raising with me and with all of us more so than most issues has been housing and fear of losing their housing because of COVID-19. We've been clear that no one will lose their housing because of COVID-19. Today's announcement will meet that commitment. We believe we need to do more than meet that commitment. We also believe we need to provide relief for renters, for rental housing providers. The stress is off the charts right now. We need to give people security and safety in their rental housing. Early last week, the Premier asked me to to lead a rapid-fire consultation, as comprehensive as I could do it, as quickly as I could do it, because the need is so great, on what we needed to do to support renters and rental housing providers now in the time of this public health emergency. I want to thank everyone, renters, rental housing providers, your associations, everyone who's emailed me, who's contacted, phoned me. We had great conversations with so many, and I want to thank the advocates who are doing so much to protect renters and rental housing providers at this time. The need is great. Your work is really appreciated by the community today. The measures we announced today, in addition to the federal announcement and our earlier announcement on Monday of support, will help people stay safe in their homes, protected, knowing that there can be a better future. It's rough right now, but it will get better. And I want to thank you for doing everything you can to look out for your community. Now, it gives me great pleasure to introduce our Premier, Premier John Horgan, to help share what we are announcing today. Thank you, Mr. Premier.
Great, Spencer. Thank you very much for that, and thank you for the work that you did in very short order. Spencer, of course, chaired a rental task force last year, did some good work that allowed us to put in place policies and programs to protect renters before the advent of COVID-19. So I was grateful that Spencer was able to reactivate his contact list and connect with people to get a direct sounding from them, whether they be providers of rental housing or renters themselves. And I think we've taken that information and, working with Minister Robinson, put together a fairly comprehensive package, adding on to the work that we've already done with our COVID-19 action plan announced earlier this week. I think it was on Monday. I too want to acknowledge the traditional territory of the Songhees and the Esquimalt First Nations, and again reiterate that the challenges we have when it comes to addressing the pandemic, the challenges we have about keeping people safe, about making sure that we can continue to have economic activity, and most importantly, that people don't feel the most critical place for them now, as Dr. Henry has said, stay home. We don't want people to think they may lose that home as a result of this pandemic. And I've had, just this week, 17,000 emails across British Columbia, and that speaks to the anxiety and the stress that people are feeling about these issues. And it was important for us to get the mix right and to ensure that it fit into a more comprehensive plan, working with the federal government and our municipal partners to ensure that we were doing everything we could to keep people safe, doing everything we could to make sure that if they were sick or self-isolating, if they'd had their hours cut back or that they were laid off, that they would not be fearful of losing their home. And so I want to also say to landlords, to those who are providing rental housing, that we want to make sure we continue to work with you, because those rent checks are critical to your families as well, critical to you making your payments also. But home should be a place of comfort and security, and we've worked tirelessly, Minister Robinson and Spencer Chambers-Herbert, to make sure that we get that balance right. So this morning, Cabinet met and approved a package, and I'll outline some of those elements today, but it's designed to give immediate protection to renters and to landlords. First, we'll be providing a $500 a month package to help renters up to $500 a month to make sure that they can continue to stay in place and that landlords can continue to see some revenue coming in. That will be delivered through BC Housing. Selena will go into some of the details, but we use BC Housing because it's the best way to deliver this program. They're already working on other programs like SAFER, like the renters program that we already have in place. This supplemental renters rebate will be there to help people. This supplemental check will be there to help people get through the coming months. And we want to make sure that that we do this in a way that makes the most impact for the greatest number of people. I want to reiterate, if you can pay your rent, you should pay your rent. This fund is there to help those people who are in genuine distress. The fewer people who access the program, the more opportunity we have to expand it going forward. The other issue, of course, that's a primary concern to people is the prospect of an eviction during this stressful time. And I'm here to say that while the emergency order is in place here in British Columbia, BC is suspending current and future evictions until this crisis has passed. There will be some exceptions, of course, but by and large, if you're at home, you're a good landlord, you're a good tenant, you will be able to continue that relationship well into the future. That's the commitment we've made as a government. That's what we are announcing here today. $500 a month for the next 4 months, available for rent, a moratorium on evictions, and a rent freeze is the third portion that I want to talk about. This is not the time to seek rent increases, and there is just zero chance of that happening. I think those who provide rental stock understand that, and I want those that are concerned about how they're going to make it through April, through May, and through June, I want them to be absolutely certain that the government is here to help you. We have programs in place. It's not just the renters piece we're providing today, but we're topping up the federal resources when it comes to those who are going to be going on to income assistance through employment insurance. $1,000 from the province, $2,000 announced today by the federal government. We're waiving the payment of student loans until September. So again, those who are looking at where we're going to find enough money to keep going, we're going to add a whole host of modest programs to make the whole package work for everybody. And lastly, before I turn the microphone over to Minister Robinson for some more detailed assessment of the package that we put forward, because there are a couple of other elements, I want to just say a word about those who are concerned about their mortgages. I've been hearing, regrettably, that some banks and some financial institutions are not as enthusiastic about living up to the challenge that we have in front of us, and so I'm calling on banks and financial institutions to work with mortgage holders to make sure that we're doing everything that we can to get through this difficult time. All of us working together is the only way forward. We've seen extraordinary cooperation in British Columbia over the past number of weeks. We need to redouble those efforts going forward. We need to make sure that we're doing our part by listening to Dr. Henry and ensuring that we are self-isolating if they're not feeling well. We're exercising distances that are appropriate at this difficult time. And also, again, most importantly, continue to keep your hands clean. Continue to work with your neighbors to make sure that they've got everything that they need. Working together, we're going to get through this. No one's going to lose their home. We're going to put some resources into the pockets of people so we can keep the economy going. I think we're on the right track. I know with everyone's support working together, we'll get through this. And with that, I'm going to invite Minister Robinson to step up and fill in some of the details on the program that we announced today at Cabinet. Thank you very much.
Well, thank you, Premier, and I too would like to acknowledge that we're on the territory of the Lekwungen-speaking people. Well, we all know that the next few months are going to be difficult. That's been clear for some time. And we need to remember to keep doing everything that we can to support each other. Because frankly, that's the only way that we are going to get through this. And it's why we have been working hard to develop supports for people who are suffering job loss and other difficulties as a result of COVID-19. And it's important to remember really what this is about. It's about the people that we love. It's about our families. It's about our neighbors. It's about our friends. It's about our colleagues. It is about our communities. And this is an unprecedented challenge. And it will require every single one of us doing our part. It will require all of us to come together as a society to protect each other. So this past weekend, I talked about some first steps that we are taking to help people who don't have homes right now. And on that front, there is much more to do, and there's more to come. And as we do this work, it is critical to make sure that people in British Columbia are not made homeless because of COVID-19. At a time when we are asking people to stay home to prevent the spread of this virus, we have to make sure that people can keep their homes. The Premier mentioned measures to protect people's health, such as new powers for landlords to restrict, one of the things that we're doing with these new powers is to restrict the use of common areas and to stop visitors coming to the building, so landlords will be able to do that to help keep everyone safe. We've all heard Dr. Henry and Minister Dix outline what it's going to take to slow down this virus so that our healthcare system can keep up. So we have to keep distance from each other to keep the virus from spreading. That means that we shouldn't have visitors over. We have to minimize the number of people touching shared surfaces and running into each other. So this new rule will let landlords restrict access to common areas. For example, restricting how many people can be in a shared laundry room at once, or close down shared spaces like game rooms or other social spaces that might exist in a multi-purpose building. This is to protect the health and safety of everyone in these buildings and beyond. On that same note, we are also restricting the right of landlords to enter people's homes unless there is a clear threat to people or to property. Tenants have to be able to protect themselves and others from the virus. Keeping people out of their homes is part of maintaining the distance that we all need so that we can all be safe from COVID-19. We are also halting the enforcement of existing eviction notices issued by the Residential Tenancy Branch, except in extreme cases where there are safety concerns. And there are a small number of court-ordered evictions that are up to the courts, which operate independently of government. I do understand that the courts are aware of this issue, and I will allow the courts to speak for themselves. We are pairing all of these actions to stop evictions with rental supports that will support landlords, so that they too can stay afloat and meet their needs and the needs of their families. The new rental assistance program will be available to low and moderate income individuals who have experienced a significant reduction in their income because of COVID-19. And we're going to ask that tenants and landlords that you talk to each other about how to pay rent as you would in a normal course of your exchange and in your relationship, if you can. The supplement that we're proposing with this new program is to help address any shortfall. Because many landlords, especially families with secondary suites, they too depend on rental income to pay their bills. And through all of this, we are making changes so that people can continue to access the services that they count on at the Residential Tenancy Branch. As a government, we are here for tenants and we are here for landlords. We know this is a scary time. And it is made harder because we can only offer comfort from a distance. But we are going to get through this. We have to talk to each other, we have to support each other, and we have to recognize how hard it is on all of us. But the more compassion, the more kindness that we can show each other as we go through this together, the stronger we'll be when we get to the other side. Thank you.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.